So Dr. Hammerman, how long have you been doing dentistry? When did you graduate?
For over 25 years. I graduated back in 2000.
25 years. All right. So over the course of 25 years, you've done things. You've been an instructor, you've been the resident instructor, you've been in private practice, you've owned practice. So you've seen all sorts of things in dentistry. What are some of the coolest things or some of the biggest transformations in dentistry that you've seen, like in your entire career?
Actually, the biggest advancement is in implant dentistry.
Okay.
Taking somebody from a completely devastated bite or mouth and completely redoing it so that not only are they able to function well, but now they actually have teeth.
Was that like someone who had trauma, or is this just someone who's missing one teeth? Like,
No, this is patients with years of neglect.
okay.
Yeah.
Okay.
Yeah.
So would you say that implants are now kind of the standard of care for tooth replacement?
Absolutely.
Okay, why do you say that?
Well, first of all, they're completely man-made. You don't have to worry about removing or prepping adjacent teeth on either side of a space in order to replace a tooth any longer.
Okay.
So if you have teeth that are on either side of a missing tooth and they're in good shape, you leave them alone. You can place the implant, which will essentially replace the missing tooth root, and then build on top of that.
So have there been advancements in implant technology, or have they been the same in your 25 years? Or, how is it different now than when it was?
Well, as you can probably guess, everything's digital now, right? So no, there have been a lot of advancements. I mean, the implant dentistry has been around for 40 years.
Okay, so touch on that. I like where you're going with that. So the digital aspect of implant dentistry, how is it that we do it differently here than what has been done maybe in the past?
Well, back in the past, a lot of it was implant dentistry was only as good as the clinician, okay? Now, with CBCTs or CAT scans, we can actually take a lot of the guesswork out of implant dentistry. We know where the bone is now in 3 dimensions, where before we were relying on a 2-dimensional X-ray to determine where we're going to place the implant.
Would you say that having a guided surgical guide using that 3D X-ray you speak of allows us to be more conservative with the surgery even?
Absolutely.
So I can tell when you talk about implant dentistry that you kind of perked up a little bit. It's obviously one of your passions in dentistry. And tell us why, or tell me why.
Yeah, it's definitely a passion of mine. I mean, to be able to take someone who is missing either one tooth or multiple teeth and be able to give them the closest thing that you possibly can to their natural dentition back is amazing.
That is pretty cool.
Yeah.
Thanks, bud.
Sure. Thank you.